This is another examination station which could be part of a 2-task station. Mr. Peter is 68-year-old retired bus driver who has type 1 diabetes for 35 years. Please perform sensory and motor examination of lower limbs for effects of long-standing diabetes. So to deconstruct the question, this is an old man who has long-standing diabetes. So your task is, although it says sensory and motor, there may be a few other areas to cover in examination. And remember, there could be another task along with examination in the actual station. Okay, so initially you know that you have to build rapport with the patient, gain consent to touch them, explain the exposure required and the positions you'll be doing. Also explain that over time you would be touching their feet, feeling pulses and checking sensations with different equipments. So first of all, once you have adequate exposure, you will do inspection. Comment on the skin discoloration, nail discoloration, any ulcers that you can see, any pressure areas, especially lifting their feet, and look at the back of heels if there are any redness. Look for fungal infection in web spaces and also inspect for muscle bulk. When you palpate, comment on the temperature, and then main task on palpation is checking pulsation of dorsalis pedis. You can also check posterior tibialis. Then the actual tasks, sensations. You need to know dermatomes to check for fine touch using a cotton and pain with neurotip. Sometimes you could perform the touch sensation on their arm to tell them how it feels, or some teachers advocate touching on their upper sternum to say this is how it feels. Patient should then look away or close their eyes and say yes when they can feel. You could alternate between the legs. Now remember the dermatomes. The medial part of knee is L3, the upper anterior shin is L4, lower anterior shin is L5, and the fifth small digit or lateral aspect of the foot is S1. You will check sensation in all those 4 dermatomes. Then you will check joint position. Again, this is a tricky area. You have to explain to the patient that you will be moving their toe up and down. Show them what is the up. Move the toe up and down a few times and show them this is up and this is down. Okay. Then ask them to look away and close their eyes, and then move the toes and keep in one position and let them guess whether it is up or low. Finally, vibration with the tuning fork. You will check on the interphalangeal joint of the great toe, just at the base of toe. Then on one of the bones on the prominence of the foot here, you will check on the medial malleolus, anterior shin and tibial tuberosity. So the main 4 points are base of thumb, medial malleolus, mid shin and tibial tuberosity. This is because sometimes the loss of sensation is in a glove and stocking position. So there may be no sensation below a certain level and sensation may be intact above that. Remember to do this on both the lower legs. Finally, in motor examination, you would have already looked during inspection for the muscle bulk on each leg. Check for power at ankle joint. Now, neurological examination, you will remember that you have to first demonstrate the movement to the patient, that ankle dorsiflexion and plantar flexion. Sometimes patient cannot easily understand and you have to demonstrate passively, and then ask patient to do an active movement and then ask the patient to do movement against resistance. Once you have checked for power, you will check tendon reflexes at the knees and at the ankles. finally plantar reflex, Babinski you will check. Okay, and then you will give a closure to the patient by thanking them and then talking to the examiner.